have here your x-ray, and I can tell that you do have a dental implant on the right upper side, and your molars are impinged, so they're pushing on your other teeth, and that could cause a lot of problems. Definitely. Okay. Before we jump to any conclusions, I would really like to do a cranial nerve examination, and it's going to be pretty simple. All I have to do is just check all 12 cranial nerves. Are you experiencing any pain at the moment? Okay. So on a scale of 0 to 10, how bad is your pain right now? Okay. And are you experiencing any numbness around this site right here? No, just pain. Okay. Do you suffer from any allergies? Okay, I'm going to go ahead and do a color test on you, okay? So I'm gonna need you to tell me what colors you see wherever I point on this card, okay? Alright. Can you tell me what color you see right here? Over here. Purple. Good. And what about this J right here? What color is it? Green. Good. And this H right here. Okay. And what about this Q right here, right? Above my finger. It's black. And here. E. Red. Okay. And what about this one? X. Yes, it is yellow. Okay, so that's appropriate. Now I'm going to go ahead and show you just a few more colors just to make sure that we have everything on track and we are not missing any. Diagnostic. Can you tell me what color you see right here? Okay, blue. And what about this one? Yellow. That's good. And what about this one? Green. Excellent. Just keep going. Red. Very good. And one last color. Orange. Okay. Okay. Alright, let's go ahead and check your peripheral vision. And what I'm going to have you do is I'll have you cover one eye. Alright, I'm going to go ahead and help you out with that. Is that good? Perfect. So what I need you to do is to tell me when you see the green ball in your field of vision. Now. Good. Now. Good. Now. Alright. Alright, I'm going to go ahead and switch eyes. Perfect. Same thing. Now. Good. Now. Good. Now. Good. Alright. Okay, can you please look straight at my nose? Good. Keep on looking straight. Okay, pupils are round and reactive to light. I'm looking for any rapid movement. Okay. I'm gonna have you follow the light, okay? With your eyes only, don't move your head. Okay, very good. And now I'm going to go ahead and bring the pen light very close to your nose, and I need you to keep on focusing on the pen, okay? So keep on focusing on the pen. Okay, very good. So that was no deviation in your vision, but let's go ahead and just try that one more time. Keep on looking right here. It's going to come very close, very close, very close, very close. Good. Okay, that's good. Now I'm gonna have you again cover one eye, and I'll do that for you. Is that okay? Okay. And can you please tell me when you see my light in your field of vision? Now. Okay. Covering the other eye now. Same thing when you see my light in your field of vision. Now. Okay. I don't have any pockets. That's okay. Okay. I'm going to go ahead and further check your peripheral vision and eye movement. So what I'm going to have you do is I'll have you kind of keep your head straight, look towards me, at my nose maybe. All right. And I need you to tell me when you see my fingers moving, okay? I might wiggle them, so I need you to say left or right. Good. 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 Perfect. Good. 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 Okay, that's very good. Can you please tell me when you don't see my fingers in your field of vision? Keep your head straight for me, please. Good. 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 Now, okay, that's good. Okay, I'm going to check your eyes for color deficiency, and I'm going to ask you to tell me what numbers you see right here. Okay. 6. 5. 16. Okay, I'm gonna go ahead and further check your vision. Have you ever used the Snellen chart before? You haven't? Okay, no worries. I'm going to explain everything. So what I need you to do is to cover one eye, whichever you want, right? Is good. Okay. And I'm going to ask you to read some of the letters and some of the numbers that you see. All right, so first, what color do you see right here? Okay. And what color do you see here? Green. Okay. Can you please read the last row, starting with the first letter to the left? Very good. Okay. So now let's go ahead and switch eyes. And And I'm gonna need you to do the same thing. So read the letters, but starting with the first letter to the right. That was really good. Okay, I have no concerns there. Now, can you please tell me what color you see right here? Okay, that's red. And the one above it? It's also green. Perfect. Okay. Can you read these letters right here? They're too small. Okay. I'm going to go ahead and make a note of that. It's 20/10. I'm going to check your facial sensation, but only around your eyes. Okay, and every time I touch you, I need you to tell me if you feel sharp or dull. Sounds good? Okay, so go ahead and keep your eyes closed. So go ahead and keep your eyes closed and tell me if you feel sharp or dull. Dull? What about now? Dull. 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 Also dull. Dull again. Dull. Dull. Yeah, so all I want to do make sure is that you can feel even the light touch, and I'm gonna go ahead and switch it up now. Okay, now I'm going to check your sensation to cold. I have here a cold instrument, and what I'm going to do is I'll touch you around the sides of your eye, above it and below, and I want to make sure that you do feel the sensation. Every time I touch you with this, I'm going to need you to tell me if you feel cold or warm. Okay, let's begin. Okay, cold. 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 And cold. Okay, that was really good. Okay, I'm going to do one more vision check. So what I'm going to need you to do is to look at the light. Just follow the light with your eyes only. Don't move your head. Good. Perfect. Okay. inside your ears just to make sure that everything looks good. There are no signs of infection. So I'm going to have you look that way for me, please. The bonding membrane is intact and no signs of infection. Okay, that's good. The bonding membrane is broke right on this side. I'm not concerned. Have you noticed any problems with your smell? Do you smell smoke or something that is not around you and it smells like? Okay. Can you please describe a little bit what happened? Okay, you were at the gym and it started to smell like bread. Yeah, I'm not sure if that was just a sign of hunger, but let's go ahead and check your smell now. So I'm gonna have you close your eyes and I'm gonna need you to tell me what this smells like. Take a deep breath in and breathe out. Keep your eyes closed. Okay, and it smells like coffee. Very good. Yes, I'm not going to give you anything to smell that could make you more hungry than you are. Okay, and I've noticed that you do have some redness in your eyes. There's nothing concerning, so what I'm gonna do is just to put some redness relief liquid in your eyes, just 2 drops, and that should definitely help. So I'm gonna have you look up. Okay, go ahead and keep on looking up. Good. And 1 more. Perfect. And same thing on the other side. Keep on looking up, up, up. Okay. Alright, yeah, that one was a little bit more red than your right one. Okay, can you try this smell one more time? I just want to double check something. Okay, so your olfactory nerve is intact. I'm okay with that. Even though I haven't noticed anything abnormal in your ears, I noticed that you do look a lot at my lips while we're, having this exam, and that could be an indication of some hearing problems. I just want to double check with a tuning fork to make sure that your hearing is intact. Okay, so what I'll do is I will create vibration sounds and I'll put the tuning fork behind your ear, and I need you to tell me when you don't hear it anymore. Okay, so that's 1. Tell me when you don't hear it. Okay, and that's 2. Tell me when you stop hearing the sound. Now, okay, so let's go ahead and do the same thing on the other side. Okay, so that's 1. And this is 2. Can you tell me when you don't hear it anymore? Now, okay, let's go ahead and do that one more time. Go ahead and tell me when you don't hear it anymore, okay? Now, one more time. Now, and you don't hear it anymore. Okay. Okay, and let's go ahead and check your mouth. I'm gonna have you give me a big smile and now frown and puff your cheeks. Keep them puffed. Don't let me unpuff them. Okay, very good. Can you lift your eyebrows super, super high? I'm going to try to lower them. Good. And now. Okay. And I'm going to have you turn your head that way. Okay. And try to resist. Good. And we'll do the same thing on the other side. Now turn your head that way and try to resist my pushing. Okay, that was really good. Can you please put your arms up just like that? I'm going to press down on them. Good. Good. And now both in the same time. Okay. And now I'm going to try to open your arms. Don't let me do that. Okay, that was really good. Can you please squeeze my fingers? Good. And now both in the same time. Okay, excellent. And I'm going to go ahead and check your reflexes. So what I will do, I'll tap on your chin first. Okay, that was good. Elbow and your wrist. Good. Same thing. Okay, that's good. Your wrist. I'm going to go ahead and palpate your neck. Let me know if you feel any kind of pain. Okay, and now I'm going to palpate your head to make sure that it's symmetric and I'm not feeling any kind of lumps. Okay, can you please shrug your shoulders and try to resist? Pushing down, that's good. And can you lift one knee up? Good, and the other one. Okay, and can you please tell me how many fingers you see? 2. And what about now? 4. And what about now? That's good. And what about now? 3. Excellent. I'm going to go ahead and check your mouth. Can you please open your mouth as wide as you can? Good. Excellent. Okay. Can you stick your tongue out for me? And now move it up and down and side to side. Good. Can you please push with your tongue inside your right cheek? Good. Push with your tongue inside the left cheek. Very good. I'm going to go ahead and palpate your chin, your mandible. Excellent. So no problems there. And have you noticed anything abnormal with your taste? Alright, so I'm going to need you to identify this taste for me. I'm going to just scrub your tongue a little bit, so please give me a big ah. Okay. And what does that taste like? Lemon. That was good. All right, let's go ahead and try one more. Can you open your mouth? And I'm going to scrub this on your tongue. Okay. What does that taste like? Bananas. Okay, excellent. I noticed that the right side is the one painful. So right here on your chin, what I'm gonna do is I will take just a few measurements. I want to see exactly the percentage of how much is compromised on the right side. So what I'm gonna need you to do is to keep your head still, almost at the same angle with your spine. Okay, good. So go ahead and just relax for me, please. The same thing on the other side. Let's just double check symmetry here. Okay. And now I'm going to go ahead and just do 2 marks on your chin. Can you please tell me exactly where it hurts? Actually, you know what? Let's go ahead and do just a trigger test, okay? I'm going to get my instrument really quick. Okay, and what I will do is I will gently press down. I need you to tell me when it hurts and when it doesn't hurt. So if it hurts, just say it hurts. And if it doesn't hurt, say it doesn't hurt. Okay? It doesn't hurt. It doesn't hurt. It doesn't hurt. It hurts right there? Okay. I'm just going to go ahead and mark that. And I'll continue until the pain stops. It hurts. It hurts. It hurts. It doesn't hurt. Okay, so that's a good sign. We're going to go ahead and stop right there. So I'm going to just mark that. Okay, and now I will take a measurement of what we mark there. So that's about 4 millimeters. It's very small size. Okay, let's go ahead and check your heart. Have you noticed any palpitations? Any skipped beats? So go ahead and, can I put the stethoscope underneath your chest, underneath your shirt? Okay. All right. Can you please relax for me? You don't have to do anything. Just breathe normal. Okay. So that's good. No S3, no S4. I'm going to go ahead and just listen with the bell here to make sure that I'm not hearing any murmurs. Okay. Can you please take a deep breath in? And breathe out. Okay, that's good. One more time. Take a deep breath in. And breathe out. Okay, let's do that one more time. Take a deep breath in. And breathe out. Okay, and again, take a deep breath in. And breathe out. Okay, so no signs of pneumonia. I'm going to go ahead and show you exactly what the problem is. So I don't know if you're noticing right here on the lower side. This is your right mandible. And there's this big nerve that goes right underneath all your teeth. And somehow this tooth is damaging your nerve right here. And that's what is causing the pain. In some people, they might have just some sensitivity, tingling sensations, even numbness, but for you it's pain. And it's just something that you need to learn how to manage. Okay. My diagnosis for today is trigeminal neuralgia. I'm going to go ahead and prescribe some pain, but what you could also do is to just apply heat and alternate with cold therapy. That will help reduce some of the inflammation. Do you have any questions for me? Okay, well, in that case, I'm going to go ahead and let you get dressed, and if you need any other questions answered, go ahead and let me know, okay?